The aorta is the largest artery in the body. It starts right at the heart, comes kind of up in the chest, and then curves back around, goes on down towards the legs, makes it to right around the belly button where it divides into two branches, one going to the right leg, one to the left leg. And aneurysm is a weakening in that artery. Weakening, when it's subjected to your standard blood pressure, that weakened area becomes thinned out and dilated up a little bit, becomes even more weakened, more blood pressure, more expansion, more thinning, and this cycle goes on until there comes a time when the aorta can no longer contain your blood pressure and it ruptures. Now, ruptured aortas are not very good things to have. They have a very high mortality associated with them. And what aneurysms essentially are, as I said, is bad things waiting to happen. Rupture and bleeding is the thing we worry about most. Here is a CAT scan depiction of an aneurysm of the abdominal aorta, but we also have an aneurysm further down in the pelvis. This is called the iliac artery, and so you can get aneurysms in other locations as well, and you can also get them up in the chest. This is a picture of an aneurysm up in the chest. In this case, this is a computer rendition where clot in the aneurysm is colored yellow, which is why you see this big yellowed area here. There is a genetic element to aneurysms. And if you've got parents or brothers or sisters who have an aneurysm, then you're more likely to have one. Unfortunately, there's nothing you can do there except be aware that you have it in your family. Make sure your doctors are aware of that so that they can appropriately evaluate for that. Can't change your gender either. Men, this is just one of those bad straws we got in life. We're more at risk for these aneurysms, but there's not much we can do about it. What we can do is we can stop smoking. We can also stop smoking. And if that doesn't take care of it, we can stop smoking, all right? This is huge. I mean, smoking is just so huge. You can't imagine how frustrating it is for us as vascular surgeons day after day after day to be treating patients who basically create their own disease and then create their complications from our treatments by continuing to smoke. We don't have any real firm correlations between cholesterol levels and blood pressure levels and the development of aneurysms, but we know that if your blood pressure is not well controlled, your risk of rupture is higher. So how are aneurysms repaired? Well, the ultimate repair has to be to take the aneurysm out of circulation. You got to get the blood out of the aneurysm and depressurize the aneurysm. And you do that by replacing it with a graft, a plastic or synthetic tube, if you want, that takes the place of the aorta. And that relieves the pressure on the aneurysm. And this shows you the surgical repair of an aneurysm. That aorta is going to be opened up, and ultimately then we will sew a fabric graft in, often a Y-shaped graft like this. And this has been going on for 50 years or so, this type of repair. It's a very durable repair. And it's got really great results. The only problem is that it is major surgery, and not everybody is up to major surgery. Let's compare that to a different way of putting a graft in the aneurysm, and that's what I like to refer to as a liner technique here. So instead of opening up the patient and sewing in a graft here, what about if we just put a liner inside the aneurysm? Kind of like an inner tube, if you want to think of it that way. And that's what's been done here. Now, these liners have stent material on them, which is what gives them this lattice type pattern here on the CAT scan, almost like a screen. But they also have fabric on top of the stent. And so it's just like that other repair I showed you. It's a fabric type graft. The difference is that in the regular surgical repair, we attach the graft to you with stitches. In this type of repair, we rely on sutures or hooks or barbs or things like that in the stent graft actually to hold it in place. Once we've done that, this has been a very effective means at treating these aneurysms in a less invasive way. So which repair would be best for you? The open surgical repair where we sew the graft in, or this liner technique where we just put it in through the groin incisions? Well, I think the take-home message that I'd like to give to you about which repair is best for you is that your interests are best served by a board-certified vascular surgeon, because although other specialties fix aneurysms in some of these ways, only board-certified vascular surgeons can perform both types of these repairs, and therefore are the least biased in determining what's the best repair for you, and therefore getting you the best possible outcome by providing you the best possible repair. So I hope that gives you some information and background about aortic aneurysm.